Welcome to the Outperform Cancer podcast. I'm Mary Beth Gilliam, and I'm a metastatic breast cancer patient actively seeking ways to outperform cancer. Today, we have a rare treat. We get to talk about an anti-cancer therapy that's proving to both extend overall survival and make patients feel better. Yes, you feel better and you live longer. Who can argue with that? Dr. Joseph Cullen is back with us to talk about his latest phase 2 randomized clinical trial for high-dose intravenous vitamin C, or IVC. Importantly, Dr. Cullen couples the use of IVC with standard care drugs, and he's finding nothing short of astounding results from his research. We talk about doubling progression-free survival, doubling overall survival, improving quality of life during treatment, why it works, who can benefit, and perhaps most importantly, where and how to get it. To remind you, Dr. Cullen is a highly regarded researcher and professor of surgery at the University of Iowa, Carver College of Medicine, with a secondary appointment in the Department of Radiation Oncology. He completed his medical degree and residency at the University of Iowa before finishing a postdoc fellowship at the Mayo Clinic. He's been researching IVC for about 20 years. Absolutely an expert on this topic, and he's here today to let you in on one of the most impactful anti-cancer strategies we can use as patients. Join me in welcoming Dr. Joseph Cullen. Hello, Dr. Cullen. Welcome to the Outperform Cancer podcast.
Yeah, thanks for having me.
We're so excited to have you back. And what's most exciting is the new research that you have just completed and its results. So I just want to jump right in because I know people are really eager to hear what happened in your trial. What were the results?
So this is a randomized trial where we looked at patients with stage 4 pancreatic cancer who were receiving gemcitabine, nab-paclitaxel, or Abraxane for their metastatic disease. And we in one group they got the standard of care, which was the gemcitabine and Abraxane, and in the other group they got gemcitabine and Abraxane, and then they got vitamin C infusions, 75 grams IV 3 times a week. And we wrote the trial. When we wrote the trial, we wrote in an interim analysis, which basically is a good idea to do in trials because you don't want to, in the interim analysis, if the study is futile, you don't want to continue, right? You don't want to have patients get a trial that's nothing's working. So what we had said was at 26 deaths, we were going to do an interim analysis. So we got to 26 deaths. We sent all the data to our statistician, and he called us back and he said, yeah, it's significantly different. And not only that, if you continue to the trial, it's not going to change anything. It's still going to be significantly different. There's a 97% chance that it's still going to be, the results are going to be the same because they're so great with just the first 2/3 of patients. So we were thrilled. So we talked to our data safety and monitoring committee of our cancer center, and they said, yeah, you have to stop the trial because it would be unethical to continue if you know what the results are already. So we did that. And what we found was overall survival increased from about 8 months, which is in our study, which is consistent with the literature, and it increased to about 16 months. So almost doubled overall survival, significantly different. And then when you looked at progression-free survival, it also almost doubled. It was like 6.4 months for with the ascorbate with the vitamin C, and then 3.9 months without vitamin C. So that doubled too. So we were thrilled to death. So we looked at even more of the data, and what we found was in the paper from a editing standpoint, you can say it didn't make the treatment worse in the fact that like quality of life and adverse events and stuff like that. It didn't make it worse. But if you look at it closely, it actually made those adverse events better. But you really can't say that in a publication because the reviewers will, take you to task on that. So what we said is it didn't make it worse. But if you look at the data, it actually, many of the significant adverse events were less. The other thing we found too, and is striking, is because the patients went longer, we stopped them on the trial when they showed progression, and then they had it, ethically, you have to put them on another, some sort of other trial or some sort of another type of treatment. And so we would, remove the patients from the trial when they progressed. But what we found was because ascorbate, the patients didn't progress, they got more, about twice as much chemotherapy as the standard of care patients, just because they were longer. So the question is ascorbate working? I think it is. But also a side effect might be is patients tolerate the chemotherapy better, so therefore they can have more chemotherapy and can have better results because it kills the tumor.
Okay, wow. There is a
That's a
lot to
lot.
unpack there. There's a lot to unpack there. So I'm going to just
Yeah.
go one thing at a time. Number
Okay.
one, you are doubling the progression-free survival. So that means the time with which cancer patients go from, where the chemotherapy resolves the cancer and then but until the cancer comes back. So there's this progression-free survival. So no cancer does not grow. It either stays the same or you don't see any further growth, right? That's
Right. Correct.
progression-free survival. So number
Correct.
one, you're doubling the time that they have before the cancer starts to progress.
That's correct. Yes.
Number two, you're doubling their lifespan.
Yes.
I
Yeah.
mean, the most important thing any metastatic cancer patient wants to hear, which is you're going to live longer, right?
Yeah. Right. Right. Yes.
Unbelievable.
Yeah. Yeah. 8 months to 16 months. And the 16 months with ascorbate was consistent with our phase 1 trial where we just, entered patients to see if they could tolerate it and, if there's any side effects or anything like that. And we in our phase 1 trial, our ascorbate group average was 16 months too.
Ah.
So that was kind of interesting.
So you're telling me not only are these results amazing in this study, but they're consistent with results that you've found in earlier studies. So it's like when we have more of those data points to look at, it kind of increases the strength of what we believe is true. Am I characterizing that correctly?
Exactly. Yep. Yeah.
Great. That is exciting. I mean, if there was a drug, I'm just, this is opinion. If there wasn't a drug that came out that doubled the lifespan of a cancer patient, would the world be stopping and the headlines on all the major news outlets be, new cancer drug extends overall survival by 2x? I mean, it feels like this is big news.
I think it is too. I think it's huge. I mean, our College of Medicine is going to start promoting it. The NIH has talked about promoting it. I'm not sure what they will do. I have no control over that.
Right.
But yeah, we're really excited about it.
My whole reason for doing this podcast and website is to bring attention to therapies like this that patients are not hearing about yet at the doctor's office because it
Mhm.
hasn't been through a phase 3 clinical trial, which would then success in that level of trial would then yield approval to make it available to all patients. So we're looking towards that in the future. But today, with a phase 2, it gives us a lot of confidence that the data we're seeing is real and actionable and safe.
Exactly. Yeah, exactly. And, phase two, but it was randomized. So if you look at the randomization, the groups, the standard of care, and then the standard of care plus the ascorbate, before they got any treatment at all, the groups were very similar.
And again, I'm going to bring back the fact that this is consistent with earlier research. So it should help us, with confidence to say, oh, okay, but now we're finding these results similarly across different institutions and across different studies. All of that just keeps building our confidence that this is real. This is not something that's just maybe a guess. Well, we saw it in one study. This is something that's being proven consistently across multiple studies, correct?
Right. And in two institutions, I have to say that the Medical College of Wisconsin helped us. They enrolled two patients when we one of the problems with the study is we did it during COVID. It
Oh,
started before COVID started, and then it was during COVID, and we looked at the number of patients who were actually enrolled, and it dropped dramatically in the number of consults actually seen here. So people at the Medical College of Wisconsin knew of our studies and I contacted them and they started enrolling patients too. And so,
that's fantastic. Now,
yeah,
you mentioned that this study was done with pancreatic cancer patients, and it's a really tough cancer to be diagnosed with. Uh,
right. Yeah.
and so the people that you were working with are also fairly sick. Am I correct?
Yeah, they are. So that touches on another therapy for metastatic pancreatic cancer was is a FOLFIRINOX. And that was published in the New England Journal of Medicine almost 10 years ago. And they showed an increase in survival with FOLFIRINOX. However, 40% of the patients couldn't even tolerate it. And their increase was like 4 months, if I believe, if I'm right, maybe 4 months. The reason we did gemcitabine Abraxane instead of a FOLFIRINOX is because you have to have a certain ECOG score to get FOLFIRINOX. You have to be fairly healthy, not many comorbidities, and our patient population is more elderly, and so they would have they qualified for gemcitabine Abraxane instead of the FOLFIRINOX.
So those are standard chemotherapy drugs. I know gemcitabine is used for pancreatic cancer, and I think perhaps some other cancers.
Yeah, yeah. It's let's see. I don't know which ones right off the bat, but yeah, it's
But
used for
it's
other
a,
ones.
a
Yeah.
common chemotherapy. So this is a
Hmm.
drug that's been around for a long time,
Yep.
a common chemotherapy that's given to patients. So we know a lot about it, and we know a lot about, its effects. And so the only thing that was different was the addition of the high dose vitamin C to these patients in order to get this progression-free survival and overall survival that doubled.
That's correct. Yes. Hmm.
Okay, that's pretty
Yeah.
exciting. And so I know that this is with pancreatic patients, but I believe you've done work with other types of cancers as well. Are you seeing these results in other studies?
Yeah, so we've done it in lung cancer and we showed a significant response with vitamin C in lung cancer. We have one ongoing trial where we're combining chemoradiation with vitamin C in lung cancer. We have one more patient to enroll in that trial. So once we get that patient enrolled, then we'll look at the results. We don't want to bias anybody by looking at the results now. The other one that's been quite successful is we did a phase one and a phase two trial in glioblastoma. And the phase two trial was not randomized, but it did show an increase in overall survival compared to the literature. And I think it was like 4 or 5 months. So in those patients, once again, their survival is not very high, and we showed an increase in overall survival. The next thing we need to do in glioblastoma also is probably do a randomized trial.
Would you be doing a randomized phase two trial
Since we already did a phase two, I think it'd have to be a phase three trial. Yeah,
for pancreatic cancer patients or for glioblastoma or for both?
I think for both.
For both.
Yeah, for both.
So
Yeah.
let's talk about that because I am doing this podcast because what I found when I was looking for ways to enhance the medications that I was taking, ways to try to outperform cancer, I found that there was a lot of research in this space where you had a lot of data. You knew enough to understand that something was happening. It seemed positive. It was working. Sometimes we understand the mechanism of action, which is like why it's working, which
Hmm.
is also really supportive of furthering that therapy. And but yet it's not anything that we're seeing in the doctor's office. So there's this chasm that seems so hard to pass sometimes, to just go from this randomized phase 2 trials where you really feel pretty confident about what you know to the phase 3 trials. And my understanding is that it's all about money. So let's talk about how are we going to take the great work you've done and move it from this randomized phase 2 results to a phase 3 trial that would allow patients to have access to this. Is it just money?
Yeah, I think it is. And it's also, the big pharmaceutical companies invested a lot of money in their drug of choice. They have the money and the backing to do these phase 3 trials at multiple sites. The problem with ascorbate is it's pretty cheap, very cheap. I don't know what the most common or the most up-to-date immunological drug that extends life in lung cancer, but last I saw was the cost was like $120,000 a patient.
Yeah, it's
So
expensive.
for vitamin C, it's about $50 an infusion. And so it's incredibly cheap. So the big pharma companies are not going to make a lot of money out of this. So therefore, their interest in doing something like that is probably pretty low.
So there are other funding sources. American Cancer Society, I know, does quite a bit of grants, and NIH, but it's this uptick to kind of a multi-million dollar study that is challenging. So I'm going to put out there to all the listeners, if there's anyone who has connections slash resources that can help Dr. Cullen raise, the 3 to 5 million dollars that's required for a study like this, to contact us and let's work together to try to make that happen. In the meantime, while we're waiting for another research study to try to close the door on this and make it accessible for everyone, what can people do in the meantime? Is there a place they can go to get ascorbate? Can they do it on their own?
Yeah, they can. So there's a lot of places throughout the country, complementary and alternative medicine practitioners who will infuse ascorbate for a variety of reasons. There's one just in the town next door to us in Coralville, that does it. The problem with that is it's not covered by insurance, so patients have to pay out of pocket. In our trial, the patients didn't have to pay for anything, of course. They got standard chemotherapy and they got the ascorbate infusion for free. So that's the big hesitation. But I think I get contacted maybe at least once a week from patients who are inquiring about this. Where can I go? And vitamin C infusions are very common, and you can almost find anywhere.
So recap for us what if they were to go get treatment from a naturopath or clinic nearby, what would they need to be asking for? You had a very specific level, dose of
Mhm.
the high dose vitamin C and timing for it. Can you just recap that again?
Sure. Yeah. So what we did in our trial, we gave 75 grams intravenously 3 times a week, Monday, Wednesday, and Fridays. And when you do that, you obtain millimolar levels in the bloodstream, like up to 20 millimolar. And at those levels, it kills the cancer cells. If you take it orally, as we've discussed before, you only get micromolar levels in the blood. And at those levels, the vitamin C is acting as an antioxidant. And when we give it at really high levels, it's like a pro-oxidant. So I try to tell kind of lay people, It's like the rust on your car. That's a pro-oxidant. And that's what vitamin C is doing basically to your cancer.
Okay. So let's expand on that a little bit because I know you've been contacted by oncologists in the past that are concerned that if they do high dose vitamin C, that it's going to interfere with chemotherapy. What do we know about its interaction with chemotherapies?
So with every chemotherapy we've tried and any type of radiation dose we've tried, vitamin C is synergistic, works together with the chemotherapy, or is additive to the chemotherapy as far as killing the tumors. We've not found one chemotherapy where vitamin C at the doses we're using reverses the effects of the chemotherapy. We haven't found one chemotherapy in the lab that it reverses.
And you've looked at this with several.
Several, yeah. Basically we looked at FOLFIRINOX for pancreatic cancer. We've looked at cisplatin for a variety of cancers, renal cell, temozolomide for glioblastoma, cisplatin, like I said, for lung cancer and renal cell. So a variety of really the common chemotherapies that are used now.
Mhm. And my understanding is that you have a really good grasp on how this is working in the cancer cells, which is why you're pretty confident that it works to enhance chemotherapies versus interfere with chemotherapies. So is that what they call a mechanism of action? Can you
Yeah.
explain just briefly what the mechanism of action is and why we're so confident that this can work together with standard of care treatments to provide enhanced benefits for cancer patients?
Yeah, so the long history of vitamin C is it was used for a lot of things, and nobody really knew the mechanism. And it was not till about 25 years ago that Mark Levine at NIH looked at this, and he showed quite clearly that oral doses get micromolar levels, IV doses get higher levels. And what he showed was quite clearly, and we've repeated these studies numerous times, is what at real high doses, vitamin C makes hydrogen peroxide, the same hydrogen peroxide you can buy at CVS pharmacy. And it makes hydrogen peroxide, and the tumor cells do not have enough capacity to get rid of the hydrogen peroxide. And that's what kills tumor cells. Because if you reverse the hydrogen peroxide, you reverse the effects of ascorbate, of
Wow.
vitamin C. It's
So
that simple. It's that simple.
wow. Yeah, that's amazing. That's
Yeah.
amazing. I think there's a torture test. If this was your mother and she had pancreatic cancer, would you give her high dose vitamin C with her standard of care drugs?
Yes, no doubt about it. In fact, one of our co-authors has had some um, medical issues himself, and he is currently on vitamin C.
Really interesting.
Yeah. Yeah.
Interesting. Because I just like to wrap up um, thinking about a lot of the rhetoric that's out there
Mm.
in the world for cancer patients. And what I've tried to do is to bring to cancer patients the science. Because there's a lot of noise and it can be incredibly confusing. And there's been literature that has been published in the past saying IVC doesn't work or it's not proven to work, or, a lot of confusion in these studies. But this study that you just completed really moves the needle about what we actually know, for sure, as scientists. So I just love to wrap up with a few words from you on, from a scientific level, how you feel about these results and the confidence that we have in this data for cancer patients.
Yeah, so it's really fulfilling for me because we started this in cell work, we went to animals, and now we're showing it in patients, and we're seeing the same progression and how it does work. And this is the first randomized trial looking at what we call a redox active compound like vitamin C showing benefit in cancer patients. So I think that's what the most exciting thing about this whole vitamin C story is.
Excellent. Well, we are really grateful for the work that you've put in. How long have you been working on this? How much of your life?
Yeah, it's 20 years. It's been about 20 years since Mark Levine from NIH came here and talked to our group, and he talked to our group because he was getting a lot of pushback at NIH for doing this, and so we started the trials, and it was really a medical oncologist here at Iowa, Dan Burke, who's since retired, who really stuck his neck out and said, "Yeah, let's try. The data looks pretty good. Let's try it." And now all the medical oncologists are throwing vitamin C on every tumor that comes in the door, it seems like, and have opened up a bunch of trials. And so it's been nice to see that progression.
That's awesome. And I'm assuming that the capstone on this for you after 20 years of work would be to get that phase 3 clinical trial and make this accessible to all cancer patients.
Exactly. Yep, exactly. It'd be great to do. Yeah.
Well, let's see if we can make that happen. That's really
Okay.
exciting. I think that's got to be our new goal. Patients that are interested in Dr. Cullen's work and the recent research paper that was published should go to the show notes to find links to that information and also to the website at outperformcancer.com to find out clinical trials that use high dose vitamin C, both that are open today and that are coming soon. Thank you so much, Dr. Cullen, for all of your work and for this incredible paper. We really appreciate it.
Great. Thanks for having me.
And now, an important announcement. All the information that was provided today was for educational purposes only. I'm a patient, just like you. I am not a licensed or accredited physician, therapist, or clinical researcher. All information provided is not intended as a substitute for the advice of a physician, therapist, nutritionist, or any other qualified healthcare professional.